Hello to all of you who fall under the provisions of the HIPAA laws. You've been selected to be asked to watch this very important and informative outreach video by DUMATEK. You've been selected because we at DUMATEK believe that you are sharing patients' healthcare information through different mediums. And being a small business, you probably aren't aware of the requirements when you share patients' healthcare information today. My name is Jerry Dumatal, and I am the founder of DUMATEK and the author of Compliance All. DUMATEK has been around for over a decade with a mission to help small business healthcare providers and payers meet continuous compliance to security. And Compliance All is a managed compliance service program we refer to as MCSP, used by small healthcare providers and payers today as a tool to meet continuous compliance to HIPAA security. So let's start first with, what is HIPAA security? HIPAA security is a law, and it became final in 2003. It is the HIPAA law that protects the confidentiality, the integrity, and the availability of the patient's healthcare information in electronic form. This information is commonly called electronic protected health information, which is a mouthful, so for short we call it e-PHI. e-PHI is normally resident in computer systems and telecommunication devices used in healthcare today. So if you manage, store, or transmit and share e-PHI today, you are required to already be in compliance to the HIPAA security rule. DUMATEK, as a company with a mission to protect patients' electronic healthcare information, we are in shock in the findings of our assessments in the small business sector, which happens to be the biggest sector in the healthcare industry, by the way. 9 times out of 10, small healthcare providers who do not afford to employ full-time IT staff have no idea how to protect the patient's information they manage, store, transmit, or share. This should be very alarming to patients, so we at DUMATEK aim to educate patients today. We found so many healthcare providers who have no mechanism to identify activity within their computer systems and networks. In other words, they cannot tell who touched or saw a patient's medical record or healthcare information. Or they can't even tell if a user deletes a file or copies a record. Bottom line, the healthcare provider will not be able to tell a patient if their records were altered. This makes it difficult to address a disgruntled employee scenario. And a lot of the agencies are not using any encryption tools, meaning there is no encryption going on. And today, a covered entity cannot meet compliance without encryption when sharing e-PHI or storing it off-site. First, let's ask, is the U.S. Department of Health and Human Services, who we know as HHS, enforcing this HIPAA security rule? Well, the answer to that question is yes. The Office for Civil Rights, who we know as OCR, under HHS, is today's appointed enforcer. The Centers for Medicare and Medicaid Services, who we know as CMS, was once the enforcer, but was replaced by OCR in 2009 due to the criticism CMS was getting for not enforcing the HIPAA security rule during their time as the enforcer. Now, as the new appointed enforcer of HIPAA security, is OCR enforcing the law? The answer to that question is also yes. Today, OCR is labeled the game changer for HIPAA privacy and security compliance, and has published enforcement announcements, enforcement tools, and they also even have enforcement activities. Some of the important announcements that I think you need to know are, OCR is the new HIPAA security enforcer taking the place of CMS. Also, that OCR was looking for an auditing contractor to audit covered entities and business associates' compliance to HIPAA privacy and security. Another one is that OCR made available training sessions for state attorney generals to undergo training to identify violations under HIPAA privacy and security, and so they can prosecute under the state level. Also, civil money penalties under HIPAA have started, so there is proof now that some covered entities and business associates have gotten penalized, something that never happened under CMS when it was the enforcer. Another one is the announcement that the HITECH Act is in effect, and it amended the HIPAA privacy and security rules by significantly increasing penalties for non-compliance. Maximum penalties from the old law used to be $250,000. Now it's increased to $1.5 million through the HITECH Act. Also, there is a breach notification list published in the HHS website under OCR where you can see a lot of covered entities and business associates across the nation who have affected more than 500 patients from a single breach. So it would be interesting to see if you have any neighboring healthcare agencies in the list. Also, it is important to know some of the current activities. For one, which we just mentioned, the breach notification list is growing. Also, in regards to the state attorney general's trainings, some state attorney generals are already showing enforcement activities in their states. They've issued civil money penalties to violators already. Another thing that is happening is eligible physicians and eligible hospitals are getting incentives for converting their operations into electronic form. This involves using a certified electronic health record system in a meaningful use way, which is a prominent step towards the start of computerizing the healthcare industry. But this also means a lot of e-PHI to secure. They just launched the HIPAA privacy and security on-site audits as well, and they are currently underway. OCR, under the assistance of KPMG, a contractor, initiated 150 audits till December 2012. And if the business associates agreements are going to be audited in the process, it doesn't take a rocket scientist to figure out how these audits can affect you. Also, there are now evolving summits for covered entities and business associates and subcontractors as well, for a good understanding of the chain of trust and implications of the new business associates agreements under HITECH. Now you have to make sure that whoever you are sharing PHI with, the entity receiving the PHI needs to implement all requirements of the HIPAA privacy and security rules. Before HITECH, we were able to share PHI only through an agreement that the associate will keep the information private. It did not require them to meet compliance and implement all requirements of the HIPAA privacy and security rules. In regards to the tools that the Office for Civil Rights has, these are the things that they have published. They published the HIPAA Privacy, Security, and the HITECH Act publications. They've implemented the breach notification list, which we call the Wall of Shame, and is made available for viewing, proof of the problem, and for covered entities and business associates to get a good example of what not to do when handling PHI. Don't forget KPMG, a contractor who was already awarded $9.2 million to assist OCR in auditing HIPAA privacy and security compliance for all covered entities and business associates. Also, they published monthly HIPAA privacy and HIPAA security enforcement reports for help, so you can see what's going on. They also have white papers for self-help compliance and understanding and other related news. To meet compliance to HIPAA security, 18 security standards need to be implemented into the healthcare operations. There are required and addressable implementation specifications that need to be in place to meet the security standards, and if they are met and maintained, it would be safe to say that your healthcare operations is meeting continuous compliance to HIPAA security. So going back to the statement made at the beginning of this video, we at DUMATEK believe that many healthcare providers in the small business sector who manage, store, transmit, and share e-PHI today are not in compliance. And even without the existence of the HIPAA privacy and security laws, patients' healthcare information is at risk simply because of the lack of security outreach and knowledge. So after telling you all this, I'm going to give you the opportunity to identify if your healthcare operations needs help in protecting the e-PHI you manage, store, or transmit and share. And if you think you need help or feel that your healthcare operations has lack of security and falls short on compliance, view the next video to see how you may attain affordable help as a small business sector covered entity. Thank you for viewing this outreach video by DUMATEK.